Now, we'll be moving on to our next session, which is the panel discussion 4. The topic of the discussion is global health equity, bridging the digital divide for inclusive digital health solution. In this session, we would primarily be talking and addressing the disparities in the access to the digital health technologies and explore the strategies for overcoming challenges related to the socio-economic factors, geographical location, and diverse healthcare system. Discuss how to ensure that digital health innovation are accessible and beneficial to all, regardless of all their background or location. This session is being moderated by Mr. Achisman Mohapatra, who is Executive Director at GRIP Council. Welcome, sir. Our panelist, Dr. Sunil K. Ketrapal, Director, Association of Healthcare Provider, AHPI. And along with him, we have Mr. Puneet Daya, Founder and CEO of Traxova.
Hello, Ms. Alicia. Thank you so much for the kind introductions and for introducing the audience to our session and also introducing us to the audience. Thank you for having us. My regards to Mr. Saugat, who has been the brain behind this session. And my hello to our expert panelist, Mr. Puneet Daya. Thank you so much, sir, for joining in.
Yeah.
Saugatji, any opening remarks from your side before we get started with this panel?
No, I guess Asimal, you can take it up from there. I think it's great having all of you, Puneet, all here on the same platform, in the same dais. And I think it's a wonderful opportunity wherein we can discuss and explore many of those things, probably, as we were hearing from in the past sessions, things which probably are a myth or a reality. I think this platform actually will open up all those dimensions. It's really great to have all of you once again. Thank you so much. Please carry on.
Yes, thank you. Thank you for having us for this panel. And I had a chance to listen to what Dr. Urvashi Prasad was just sharing, and very, very, very contextual insights. And that actually sets a tone for today's discussion. And now, if we look at the digital health landscape in India, we are into some very interesting times. On one side, we have a lot of health tech startups coming up, fantastic ideas, trying to solve problems for a country as populous as ours, like 1.4 billion people, and access being a definite issue. And trying to integrate those solutions into the system, both public and private, and at different levels of the health system, starting from primary, right in the community, and also right into the hands of the end user. So patients into self-monitoring, to all the way to tertiary and quaternary healthcare setups, and further integrating those data points to inform policy decisions. So quite a bit of transition that our country is going through. And on one hand, when we have these kind of health tech enthusiasts into startups, we also have the government responding to it through Ayushman Bharat Digital Mission, which creates an ecosystem. And we have stakeholders right from governments, regulators, healthcare providers, individual providers, NGOs partnering there. And then again, we have challenges as well. How do we make these kind of technology more client-centric, more patient-centric? How do we ensure that our people, which is at times digitally not as literate, adopt these technologies and still make the most of it while ensuring that their data is protected and privacy is maintained? Quite a bit of discussions we have going forward, and I welcome my panelists, Mr. Puneet Daya and Dr. Sunil Ketarpal. Let me introduce Mr. Daya, and I'd also request Dr. Sunil to switch on his video. Yeah, I could see you, sir. Hello, sir, and welcome to the panel.
Hello. Hi, Dr. Mahapatra. How are you?
Good. How are you, sir?
Yeah, good.
Right. So I was just about to introduce our panelists. Let's start with Mr. Puneet Daya. He has a very niche area for himself, like 24 years of international travel technology, and now he's into ensuring like people who are looking for experiences which incorporate travel and wellness, and making them meet people who are able to provide this kind of an experience. Mr. Dahiya has built the IT landscape for the 6th largest travel company in the world, and that showcases his leadership and innovation. He has collaborated with colleagues from 30 different nationalities and has a deep understanding of this sector, the global travel landscape. And he's passionate about leveraging technology for the betterment of global well-being. He founded Trexova, a digital platform that aggregates and distributes wellness holidays and activities. Welcome, Mr. Puneet. Can you just briefly give a deeper understanding about what exactly is this concept of Trexova and how you're making it go big?
Yeah, thank you, Dr. Achesman and Dr. Sunil and this panel for arranging this wonderful session. So it should be insightful and of course good for humanity, creativity, everything. So basically, if you understand this global landscape, then more than 800 million holidays were wellness holidays were taken last year in 2022 alone. So it's a big segment already, and it's a very large. People are caring for their health and well-being, especially after COVID. Even the need for preventive healthcare is also very important, just like breakdown maintenance and preventive healthcare. So that's where we kind of try to look into what the gaps are when people, on one side there are a lot of good quality wellness providers. They have excellent products and they can help people in so many ways. And on the other side, we have so many consumers looking for personal and mental well-being. The issue that we realized is only the connect. So, and moreover, how to fit the need or how to align the demand versus the supply. Because supply has so many things are available, but you don't know what fits you, what you need, when you need. And so all those, very easy to search platform, of course, now digital is the era. So that's what we are looking for. So we have kind of solved both, brought both the dimensions into one platform, where we have built a SaaS platform for holiday providers and activity providers, where they can come in, sign in for free of cost, and they can list their wonderful packages. Of course, we have criteria to authenticate them. And then, consumers can go in with their purposes in mind. Of course, everyone has their own purpose. So health and wellness, and then they can go in with their own mind. And we are so far getting a very good response. Like we have more than 1,800 holidays in 20 countries and covering 60 plus purposes of life, various purposes, covering 30 plus experiences. Yoga is just one. There are so many ways to get healthier. And of course, we have more than 2,100 instructors all over India in all big cities. So that's what we're trying to, digitally convert it and make a contribution in global well-being.
Well, quite an innovative field, I must say, very new to explore in the Indian context, and you are already into the international arena. We'll want to know more about your experiences. Thank you for your, giving us an introduction into Trexova.
Sure.
I would take this opportunity to welcome our other panelist, Dr. Sunil Khittarpal. Dr. Khittarpal has over 30 years of experience in the healthcare industry in different institutions and majorly in leadership positions. Currently, he is the director of Association of Healthcare Providers India, and this is a non-profit organization that works with the government, regulators, and different stakeholders with an objective to ensure universal health coverage. Now, HPI represents majorly, it's most of the private healthcare institutions in the country that come under the umbrella of HPI. Dr. Khittarpal has been in leadership position in many premier institutions before this. So he was the Chief Operating Officer of Rajiv Gandhi Cancer Institute and Research Center in Delhi. And besides, he was also in leadership position at Delhi Heart and Lung Institute and Indian Spinal Injury Center. Dr. Ketapal, most welcome to this panel.
Thank
And
you.
I'd also request you to give us some kind of briefing about AHPI and your experiences with it.
Well, first of all, I would like to thank World Digital Health Forum for giving this opportunity to be here on this panel discussion. And I would also like to thank Dr. Ajisman Mohapatra, our moderator, and my co-panelist, Mr. Dahiya. Well, regarding AHPI is Association of Healthcare Providers India. As you briefly mentioned that we are a not-for-profit organization registered as a society, and we represent a majority of the private healthcare institutions in the country. We work with an objective to, basically we work with the government, with the regulators, and other key stakeholders with an aim to achieve universal health coverage, that is accessibility, affordability, acceptability, availability, and to achieve comprehensive health security for all in the country. And we are, over the past 11 years, because the AHPI was founded in 2012, December 2012, so we just completed our 11th anniversary. And over the period of 11 years, we have grown steadily in strength and in recognition to become India's largest representative body of healthcare institutions. And we have a combined membership strength of, say, over 20,000 hospitals, because the hospitals are our members, and healthcare providers across the country. In fact, we have created 20 state chapters because health is a state subject. So we have 20 state chapters, and each state chapter has an empowered executive committee with the president, vice president, secretary, and 8 to 10 executive committee members. So we educate them, we engage them, and we empower them because they have good liaising with the local state authorities and the state ministry. So that's why we have created chapters. Not even that, we have gone beyond that. Some of the states becoming which are very big, I mean, state like UP, Haryana. So we have created some sub chapters like Haryana, Faridabad. We have created a sub chapter. So and then convener for that sub chapter, and also registered as a separate society. So they are maintaining a separate account. So this is how we have, over 11 years we have expanded. And I would also like to mention here that the role of AHPI, we have in fact transformed the healthcare landscape in various accolades and contributions by lobbying with the government, and we can by conducting training, capacity building for our member organizations, and also promoted knowledge sharing through our conclaves, and we have our publications, and of course we have liaised with the and supported the government. We work very closely with the government. We support the 2 flagship programs of NHA, Ayushman Bharat and ABDM. And during the COVID also, we have actually done a great work during COVID. We had to collaborate with various national and international bodies. So this is what we have achieved, and our key successes, which has created a far-reaching impact across the nation in the area of policy and advocacy. We have public-private partnership, training, capacity building, and we have various impactful publications. We have more than 50 impactful publications on various topics, which are not relevant only for our member organizations, but for the healthcare community at large. COVID-19 crisis, I already mentioned that during the pandemic, we created a national working group on COVID comprising of various other AHPI, IMA, CII, FICCI, SOCHM, NetHealth, all these industry bodies. And we promote technology and use of technology among our members, quality, NABH accreditation. So this is how AHPI has evolved and what all work we are doing.
Right. So thank you so much, Dr. Ketapal, for giving us an idea about what HPI does. It is so exciting to see that we have one panelist who gives a very global breadth, and the other panelist gives a very deep penetration into Indian context. So quite a well-rounded panel we have, and going forward, we would want to know more about your experiences. So just continuing our conversation with you, Dr. Ketarpal, I'd like to request you to reflect on your 30 years, more than 30 years of career. Uh, how do you see health tech or digital health technologies evolving in the Indian context? And what are your impressions about it? What are the challenges or strengths that you see?
Well, certainly over the past 2, 3 decades, digital health has undergone, I should say, a remarkable evolution, driven by the advancements in the technology and changing healthcare needs and shifting the regulatory landscapes. So I started experiencing the digital health transformation since 1990s. If I walk you through my experience, I think I should go back to my medical college days in 1980s, early 1980s. One of my classmates, he was my roommate as well. He had a pain abdomen and he consulted a surgeon who advised him ultrasound of the abdomen. Those days, in the whole of, I did my MBBS from Andhra Pradesh, from Karnool Medical College. And those days, there used to be only one ultrasound machine in whole of the state, that was in Osmania Medical College, Hyderabad. And my classmate who was advised this ultrasound had to travel to Hyderabad about 300 kilometers to get the ultrasound done, right? So that was the early 1980s. And then, of course, late 1980s, we saw the first CT scan. After I graduated in 86, then MRI scanner was commissioned. First MRI scanner I remember was commissioned in mass in Delhi in 1986. Then came in, if you come to 1990s, what I saw was the first mobile phone we all know, which came in 1995, Motorola, and during the same time, the first pager mobile phone also came to India. And I remember I used to feel very proud, using the pager. And then in late 1990s to early 2000, I should say, I saw the emergence of electronic health records. I remember I was working with a corporate hospital, Max Healthcare. I joined in 2001. And, I saw the, use of there was a very basic electronic health records, which was, you can say, the digital version of the patient's paper charts. So I was quite fascinated by this transformation while working with a corporate hospital. And not only that, I became an EMR champion those days and used to train doctors, including the senior consultants for EMR. And the doctors, they used to give e-prescription and they could store, retrieve, and update the patient information more efficiently. So even we used to audit for the compliance to EMR by the doctors. Our compliance percentage we used to see of each doctor for use of EMR. Then I think in mid 2000s, I should say 2004, 2005, we could see, telemedicine, which gained traction, and, remote consultation via video conferencing, and particularly for the patients which are in the remote areas, in the rural or underserved areas. Then in 2000, I think late 2000, or you can say in early 2010, there was mobile health apps, which we saw in the healthcare, and the proliferation of smartphones. We all know that how it proliferated, and the mobile apps, which actually revolutionized the healthcare delivery. The mobile mHealth apps, and there's symptom tracking, fitness monitoring, and access to the healthcare information. And in mid 2010, 2014, 15, we saw this integration of wearable devices, contact devices, and remote monitoring, which became very popular. and which also enabled us, the individuals, to monitor the health health metrics they were monitoring, and with heart rate, activity levels, and sleep patterns. So this was an era of remote monitoring solutions which emerged, allowing the healthcare providers to track patients' vital signs and chronic conditions remotely, leading to more proactive and personalized care. And then I remember 2006, I was with Rajiv Gandhi. That time, my first stint in Rajiv Gandhi as a medical superintendent. So I joined in 2016 again as a CEO. That was my second stint with Rajiv Gandhi. In 2006, we saw this Da Vinci robot, which was installed in AIIMS Delhi. The first robot in the country in 2000 came in 2006. So, and then now you see there is no end of this robots. I think every big, large institution, even secondary or tertiary kind institution, you will find robotic surgeries being done. Then let me now come to late 2010, I should say, 2018, 19. Now what we have seen is artificial intelligence and predictive analytics. These were the advancements which have played a significant role in healthcare, and AI-powered tools are developed for image interpretation, risk prediction, drug discovery, and personalized medicine, and of course, among many other applications. So 2019 to 22, what I have seen personally, during the COVID pandemic, of course, COVID was a big, it brought a major transformation in our country as far as the healthcare digital domain is concerned. And the use of medical technology and digital health in India was revolutionized and accelerated the adoption of digital health solutions. Not only in India, we all know it was worldwide, but social distancing measures, because it necessitated us, it forced us to remote. Telemedicine also became legalized during COVID. It was in March 2020. We saw the unprecedented growth, with many healthcare providers rapidly implementing virtual care solutions. And I remember, during COVID days, you were confined to the room, confined at home, and using various virtual platforms, and a lot of webinars where they were in full swing. And of course, during COVID, again, you can remote patient monitoring, telehealth platforms, digital health tools for mental health support. It all experienced increased demand, and there was a lot of innovation which has happened during the COVID. Flagship program of the National Health Authority, that is Ayushman Bharat Digital Mission, which was launched in September 2021 with a vision to create a national digital health ecosystem. And we all know that how it has revolutionized healthcare, where it is offering unique health IDs and digital health records for seamless patient care. And it is like, the ABDM is now picking up like anything. And secondly, in just recently, maybe 2022, 23, we have seen the continued innovation which focused on interoperability. So digital health landscape continues to evolve rapidly, with ongoing innovation in areas such as remote patient monitoring, AI-driven diagnostics, digital therapeutics, and blockchain-based solutions for data security and interoperability.
Thank
So
you.
looking ahead, I think what I would like to mention here, so it has all led to improved access to healthcare and enhanced patient engagement. So there's a great transformation which has happened.
Yes, quite a bit of journey that we have done as a country. Yeah, as you narrated, it almost felt nostalgic to see the sophistication with which the health systems have evolved in our country, trying to provide the best state-of-art services to care seekers. On the other side, we have also seen that along with the sophistication within the health system, there is a much of sophistication within the clientele that we're catering to. The population has become more and more health aware. Previously, it was majorly trying to seek therapeutic services, but now a whole wellness industry has also emerged where people are more and more conscious about their wellness. And there is business around it as well. As we could see, Mr. Daya is already working in that area, trying to make the seekers and providers meet. So I'd go to Mr. Daya now. Sir, you have been trying to understand the need of this particular population that is seeking wellness experiences, and you're trying to provide I guess it's customized digital platform-based services that you're trying to provide. Can you just walk us through your experiences as to what exactly these people are seeking and where is the trend going from here?
Yeah, so basically, if we generalize our target audience, so what we are catering to basically, then people who are living in big cities and they are having a lot of competition, stress, all those sort of things. So with this, people living in big cities now, of course, they are looking for health and wellness, especially as Dr. Sunil mentioned that after COVID, there's a lot of consciousness which is going towards preventive healthcare as well. So health has to be better, of course. So from that point of view, that's our target audience. And when we talk about this target audience, then the trend is that the world is getting more and more competitive day by day. Life will continue to become more and more hectic. Families will become shorter and shorter. Social connectivity will become less and less. So all those things are, we all know that this is going on. So then the issue comes that, how and what they should identify, what is their need. And that's when we are, trying to collaborate with holidays, is that when they're going on holiday, then generally you can say that people want to go on holiday to relax. So it could be a simple mechanism. And generally they have a destination in mind that, okay, I want to go to this destination to get some relax. But the moment they choose destination, then the problem starts because, you should focus on your purpose. So for example, I can just say that relax means for someone, it could be sleep wellness, because that's a very common way of addressing, everyone, very busy and hectic lifestyle. Sleep is, very difficult these days. And so sleep wellness could be, one of the need that someone may be having. Then the idea is what we are trying to do is, okay, for sleep wellness, then what you should tell us that I want to go for sleep wellness. And then platform will tell you where you can go for sleep wellness, what are the packages. And then you look at destinations, you look at your budget, you look at your, whatever needs, fits, etc., etc. And then a typical sleep wellness package could be that you go on a retreat, they do some diagnosis, assessment, and then they identify that, okay, this could be the points. And then they have the, recommended diet for your duration. And then they give you some, recommended yoga, meditation, all those sessions, and then maybe massage as well. And then they basically get your sleep, into a natural sleep wake up cycle. So rather than, so idea is that you should get yourself, normal. And then comes some maybe, some seminar or some kind of tips and tricks also they can provide, which you can use in your daily life. And when these people come back after having their basic things sorted out, then they are much more equipped that they know how they can improve their sleep, what issues are there, what are the activities they can do in their daily life. So holiday is not just about going and spending time or looking at the world. So it's also changing, needs are changing, because world will become more and more competitive. That's how big city life is, and we cannot move away from that reality. So for example, then comes because when you come back from your daily life, then you need to be more equipped. So if you see mankind, then our life was never so hectic. It's only the first time in the life. Maybe if you look 100 years back, then life was not that hectic. Maybe 20 years back, life was not that hectic. But now it has changed. And continue to changing. So we have to learn to live with it and then adapt new ways and mechanisms to address it. And another could be, for example, like I was looking at menopause retreats. So this could be another good practice that, okay, when a lot of people going through that transition, especially they need support, they need guidance, they need everything. Of course, breakdown maintenance is there, but then what is preventive maintenance? And of course, we all know preventive maintenance and breakdown maintenance in our cars. We do it regularly when we do 10,000 kilometers that we go for preventive maintenance. And why do we go for preventive maintenance? Is just because there shouldn't be any breakdown maintenance. So same way, life is very simple. We have to go for preventive maintenance. The only thing is that we don't have, we don't know where to go, what to do, how to match, what are the needs, what is my need, what options are available, who can provide reliable, not reliable. And then we can't compare. So these are all the problems that we are trying to solve. Another interesting area is like bioanalysis. So this practice is already available. So you can get your bioassessment done. So, but the only thing is that in our daily life, we are so busy and so hectic that we are not able to concentrate on that part. Whereas bioanalysis, there are a lot of bioanalysis available. So it can give you a very good data to personalize your needs, your assessment, your diet, your health, everything. And if we are on a holiday and we have peaceful time, we are looking at these things and they get sorted out, and then we understand ourselves much better. Then when we come back, we're much more prepared, much more, life, the moment you come to big city life is going to be same. It's a hectic, big problems, competition, we cannot avoid them. But the only thing is that our job is to, equip people, not only go on holiday. And when people come back from their holidays, then because sometimes they need support as well. So that's where these, we also have a network of around 2,100 instructors all over India. So they can also come for a session. You may not need it every day, but of course, you may need mentorship, you may need support, you may need guidance and encouragement, motivation. So all these things are also, so it's like end of the day, when you fall sick, you have no choice but to go to the hospital. That's it. There is no way out. But then before that, there is an opportunity you can do something about it. And that something is not urgent, but very important. So that's where, we kind of, and that's how we are trying to build this society, that whatever best is available in the world. It's like we are all one family, Vasudhaiva Kutumbakam. So we don't, differentiate between boundaries and everything. So it's more like, it should be available to everyone. People should be able to search. And that's how we will encourage the supply side as well, that they will also be more and more, innovative. And with this platform, we are also getting a lot of data. So that's also, we try to, mine it and make some machine learning algorithms to guide on both sides, on the supply side as well, that, okay, how you can improve your products and services, and also on consumer side also, that, what is more. So maybe AI recommendations and everything, so that we can do.
That's quite thought stimulating, I must say. You are trying to intervene for a category of people which is not just concerned about its wellness, but also realizes that something can be done and is hopeful. So you are keeping that hope sustained. So thank you for intervening in this space, and I'm sure this must be very impactful for the people who are participating in it. Let me go back to Dr. Khetarpal. So on one side, we see this, like I must say, these are sort of outlier experiences. The group that is seeking wellness is by far outnumbered by people who are deprived of services. How do you see equity dimensions playing out when it comes to accessing digital health technologies across geographies, across socioeconomic stratum? Whatever dimension you could think of, sir.
Yeah, I think it's a very, very valid question. And when we talk of healthcare quality, it has six elements. We all want that healthcare should be safe, number one. Number two, it should be effective. Number three, healthcare should be patient-centric. And number four, timely. Number five, efficient. And lastly, equitable. So the six domains of quality in healthcare, equitable care is one important aspect of quality in healthcare. And addressing the equity in healthcare service utilization is very essential when leveraging the digital health innovation, particularly in diverse health system like those in our country, those in India. So we need to have some strategies actually to ensure that digital health innovations are accessible and beneficial to all, irrespective of their background and the location. Now, the first thing I would like to mention here is that promotion of digital literacy. Promoting digital literacy should be the key. And enhancing this digital literacy among all segments of population can empower individuals to utilize digital health tools effectively. Of course, providing education and training on how to access and navigate telemedicine platforms, mobile health apps, and other digital health resources can bridge the digital divide. This is very important and ensure equitable healthcare access to healthcare services. Secondly, I think those companies, the health tech companies or digital health companies, who are designing their product, they should be, they also have a great role in ensuring affordability and accessibility. And how they can do is, most importantly, they should be the devices. They should be designed with affordable. The solutions should be designed with affordability and accessibility in mind. That is very important, especially for the marginalized communities or underserved communities. This may involve subsidizing the cost of telemedicine consultations, providing the low cost or free access to essential mobile health apps, and ensuring that internet connectivity is available in remote areas. And also, it should be very user-centric solutions which they should devise, because they should develop user-centric solutions through a very user-centric approach, taking into account the unique needs and preferences of the people. So this is, I think, again, will definitely help in ensuring the accessibility and affordability, and also the expanding the connectivity infrastructure. I already mentioned about the internet connectivity. If you improve the internet connectivity and by expanding the broadband infrastructure in rural and underserved areas is very crucial. When we are talking of equitable, so it should reach to the last mile. And it's crucial to ensure equitable access to digital health services. There are certain government-led initiatives, public-private partnerships, and community-driven efforts which can help bridge this digital divide, and it can connect remote communities to telemedicine platforms and other online healthcare resources. Another thing is involving and engaging the community is very important. Community engagement and outreach through awareness campaigns, health education programs, outreach initiatives, which can promote the uptake of digital health solutions and foster trust in these technologies. So collaborating with local leaders, the community organizations, healthcare providers can facilitate targeted interventions which are tailored to the specific needs, of various different population groups. And one more thing I think I would like to add here is we need to address the language and cultural barriers also. This is very important. So digital health solution should be inclusive and it should be culturally sensitive, catering to the linguistic and cultural diversity of the population. So this is important. You need to, they should provide a content in multiple languages. It should be maybe bilingual or multilingual, incorporating all the cultural nuances into the healthcare communications. And of course, but there are various challenges, ensuring the data privacy and security, building trust in digital health technologies which require robust measures to safeguard the privacy and data security. So I think this is also we need to keep in mind. And lastly, the collaboration and partnership, as I mentioned, between the government agencies, healthcare providers, technology developers, academia, civil society organizations. They all need to come together. Coming on the common platform, stakeholders can identify the barriers, what are the barriers to the access, and they can develop targeted interventions and leverage the resources more effectively to ensure that digital health innovations, they benefit all members of society. So lastly, I would commend that by adopting a comprehensive approach which addresses the not only social, economic, and technological determinants of health equity. Health systems can actually leverage digital health innovation to improve access to quality healthcare and promote health equity for all the individuals, regardless of their background and location.
Thank you, Dr. Khetapal. You touched upon so many dimensions. Clearly, it is not going to be a straight game. It's a complex, layered approach when we're trying to universalize digital health technology. As Mr. Daya was narrating, many times people experience and then need a longitudinal support after that initial experience. And in your case, as you narrated, that technology could be empowering, but the digital divide would be a dangerous multiplier when it comes to amplifying the differences in the way we utilize digital health technology. So there could be some stratum of the society which leverages technology, feels very empowered, and then there are some which are deprived because they do not have internet access, they do not have digital literacy, and so many things. Mr. Daya, I'll just broaden the scope, going beyond your travel Trexova experience. If you were to comment on how we could make these kind of services, digital health tech services, more universal, more client-centric. So on one hand, universal, and on the other hand, very customized, client-centric. Are there any innovations that you could think of? I remember you were mentioning about the AI/ML data approaches, but could you please elaborate a bit on that and any other aspect that you feel should be highlighted here?
Yeah. You have actually touched on a very important point, which is client-centric. So, of course, when we say client, it's also a big, broad word. But I must say that there's a lot of information available, but unless it is useful for that individual may not be interested. So I would say personalization is the key. So, I mean, a lot of things are available, but I will only be interested if it is relevant to me. So from that point of view, I will just divide it in two small topics. One is Trexova. So in Trexova, what we are trying to make is a digital assistant. So when we say digital, I also add to it that let's make it digital and intelligent. So digital is one part that, of course, a lot of things are digitized, but they have to be intelligently, communicated, delivered, distributed, consumed that way. So same way in Trexova, what we are trying to do is we are trying to make a recommendation, engine where, let's say, if you are having, an app which we will develop, that if you have that app, then it will keep on recording some touch points. And then it will keep on recording what your health parameters, your related to whatever you need. And then it will basically recommend you, because you don't know when to look for something, because as an individual, we are too busy in our life. We don't know, and we come to know of it very late. So the point is that if you know well in advance that, okay, these are the points. And then second thing is, what is the solution to it? There's ample amount of solution available, but then which fits me, that is more important. So that's where it has to intelligently fit you and give you a recommendation that, okay, based on your need, this is a solution and this is available. Would you like to go for it or not? So that's where we are trying to achieve an aim. And same way, if you talk about generic landscape, then as Dr. Sunil also mentioned that blockchain and AI is very important. That is the key. Use of blockchain, of course, people can use it in many ways, but I personally see that something like health parameters of every individual, if from all the touch points, like we get our blood test and we get our all kind of test, and we go to pharmacy, we buy medicine, we go and prescribe doctor, they give some prescription. So there are a lot of important things which are lying somewhere. So the only thing is that they are not available in a digitized form, in the form of blockchain, something like you can say Aadhaar of health. So in that case, if you are going for consulting a doctor or going to a hospital, so your entire history, if available to someone, you can be better guided. And moreover, like we are having digital literacy and all those issues. So where, because people go and find, let's say, Google, so I would say they are also medically illiterate in that sense, that whatever content is available on Google may not be reliable all the time and may not be relevant for an Indian scenario. So that's where our own videos in regional format or something that can be distributed intelligently to the ones who are relevant. And moreover, government can also find out that what is the macroeconomics, macro parameters of health in real time. Not that after 10 years we know that, okay, what was the index, but now what is going on in our country. And insurance companies also need it, government also need it, preventive healthcare also need it. We don't know how many hospitals are enough for us or not. We don't know how many doctors are enough. We don't know in which form and shape. For example, early parameters of a pandemic also. So if you go for a blood test, and then like we formed a basic rule that if you go for test in COVID, then the organization who is doing test reports it. So that's where it goes into your digital, that okay, government also knows that whatever initiative that needs to be taken. So a lot of information is available, but it's just that it has to be consolidated in the form of blockchain secured health card, and then intelligently solving the small problems, so that people don't need to explain so many things.
This has been a very enriching interaction with both of you. I must thank both of you, sirs, for taking out time and also sharing your experience. We started with Dr. Ketarpal showing how technology has evolved in the healthcare sector, right from early 80s till date. A long way we have come. The Ayushman Bharat Digital Mission stands testimony to all the sectoral developments we could manage. Then we went to you, Mr. Daya, and you very nicely showed how preventive healthcare services could be embedded into wellness packages. And you spoke about bioanalysis, and you also spoke a bit about data management in AI/ML. We went back to Dr. Khetrapal, who again highlighted 6 dimensions of quality when it comes to safety, effectiveness, timeliness, efficiency, and equitability. And he reflected more on the equitable dimension when he spoke about digital literacy and making our digital health tech culture and context sensitive. He also spoke about data security and the need to build trust in technologies and also mobilize whole of the society, whole of the government sectors and civil society as well. You highlighted, Mr. Daya, about digital personalization, and sort of as you spoke, I could relate the very concept of the Aadhaar ID, the Aadhaar for health, that has now come up. So fantastic interaction. Before we close down, just we have 1 more minute to go. Quickly, any closing remarks from you, Dr. Khetarpal? 30 seconds we have for you.
I would say that digital health, has it's a very transformational tool, and if you are not into digital health, you are not into health. So digital health is not future, not future. Digital health is the present.
Thank you, Dr. Ketrapal. Any closing remarks from you, Mr. Daya?
Yeah, I mean, we are a very rare country which has, very latest healthcare infrastructure and everything, and also ancient, practices like yoga, meditation. So we're a very rare country. So I think we are high IT strong as well. So I think we should lay down some foundation or growth path for the world to also, show that okay, what can be done in this regard, combining all these things, which is more inclusive and holistic.
Thank you so much, Dr. Ketrapal, Mr. Daya. Thank you so much for sparing your thoughts, sharing your thoughts, sparing your time and sharing your thoughts. Thank you, World DiGiHealth and Wellness Forum, for providing us this panel.
Thank you, Arjishman, Dr. Arjishman and Dr. Sunil. Wonderful session.
Thank you, Dr. Arjishman Mohapatra and Puneet Daya. And Alisha, thank you so much, World Digital Health Forum, for the opportunity. Thank you so much.
Thanks to our audience as well. Thank you so much for your attention. Thank you.
Yeah, thank you.
Thank you, panelists. It was a really insightful information that you shared.